Apanasmon creating new record video tutorial. Here I will show you how to create a new record from the dashboard. When you open this page or sign up to apanasmon.com, you come to this page. Please click on this new record. Here comes the record. You need to select a patient. That would be from the old list or create a new patient. Click on this create a new patient. We can create a new patient. By putting the name, we can put the date of birth, NID number, any other health number, patient's other particulars like phone, email address, and physical address can be put on. We save and select as the current patient. Here we can create different formats of records which include assessment by a surgeon, physician, or preoperative assessment by an anesthesiologist. Operation report, it involves many information during the whole procedure of operation. Postoperative report, it includes the postoperative order by an anesthesiologist or by a surgeon. Invoice, here you can create invoice to make a bill for the procedure that you have recently done. You can see all your bills together, search them by date, by institution, or even by surgeon's name if you want to put it. Analysis, here we have option to put the critical incidents where you can put the critical incident and audit your critical events. Print is self-explanatory. Here there is a two button which says publish and seal. The publish means when it is clicked, that can be available on the web, can be seen by other doctors, and if permitted by the patient as well. Once the seal button is pressed, there cannot be any change made after clicking on seal. Once we are done with the record, we can click done. Then that takes us to the My Record page where other records are there. This is one of the most important buttons that we have created to reduce the work of the anesthesiologist or the physician. When you click on this, it creates a duplicated information of the all records that was inserted in this form. That way you reduce the number of writing when the patient has repeated visit or multiple visit. Let's start with the assessment. So this is divided into few topics which are history, examination, investigation, diagnosis, discussion, optimization, and risk assessment. I will concentrate in this video on history, examination, investigation, diagnosis, discussion, optimization, risk assessment separately. Here if you look at name of surgery proposed by the surgical team, default means no name of surgery is proposed. Just to explain a little bit, default means whatever is selected here will be printed if you make no other changes. If you want to insert any name, please click on the list. Here you can write down the name of the operation. When you start writing, a suggestive number of operations are there which you can select from. If it is a mistake, please delete it. You can insert any new name that you would like, and you can add many more. Often a short shortcut can be used like LC for laparoscopic cholecystectomy. You can use this here. So whenever you are inserting a name, please try the shortcut. It may show you the name of the operation. Previous anesthetic and surgical history. This is selected as no previous general anesthesia. Same way, this is the default, which will be printed once you select this whole thing. If you want to put anything else, please click on the list. And you can add the names as described just in the previous section. Previous anesthesia and surgical complications. We click on the list. The default was nil. Here you can put any things that are already done. You can select any of them or unselect them if it is by mistake. In this other section, you can add any complication. So many of these complications added here are medical complications. Please enter any surgical complications that you would like. As an example, I just put in wound infection. Here it is seen in the list. You can delete it here if it is a mistake. And this new name can always be audited. I will take you to the audited section in another video. And there we will find that here you can find any of the inserted data that you want to look for. Family anesthetic history. This is the default, that there is no history of malignant hyperthermia, prolonged succedaneum activity, or delayed awakening. If you want to add a list, then there are few lists, and the other button gives you the freedom of adding any list that you want. History of current problem and diagnosis. Here we do what is the current complaint. Medicine can use it as a chief complaint. Surgical team can use it as a chief complaint too. Or the anesthesiologist can use a diagnosis. As we are doing laparoscopic cholecystectomy, the diagnosis can be cholecystitis. Or it can be a fall for an orthopedic surgeon, trauma, whatever the cause of the patient coming for this occasion, that can be inserted here. This is allergy. So allergy has three sections. You can either put no known drug allergies, no known food allergies, or no known environmental allergy if the patient has nothing as printed as default, or you can pick up one by one. Medicine allergy, if you put a name, you can pick it up and then you can insert what happened. Please click on this side arrow and you have a list. So just by a click, most of it is done. If there is a new name, you can add that too. You can delete it if necessary, or you can go on adding as many as you want. Activity. This is selected as 4 metabolic equivalent, or MET, is required for anesthesia in cases. So that's why it is default. Otherwise, there's a lots of stuff that you can write down. Normally anesthesiologists say how many stairs they can climb, or you can do walks. You can write down how many kilometers they can walk, or it shows in a slider. You can pull this slider to change it, or if you want to use other unit, you can change it to mile, which shows your nearest conversion. Even though this is collapsed, your information is still there. Here it's a radio button, means you can select only one, and you can write down how many climb the patient could climb, how many stairs the patient could climb. Physical activity can be added similarly, but you have multiple options here. If you want to add metabolic equivalent individually, more than 4, you can select any of them. For NSQIP data, this is calculated. That's why this is put in here. Functional health status. The patient can be independent, partially dependent, or totally dependent. Physical parameters are same. You click on this list and add whatever you would like to do. It can be done in centimeter or it can be converted into inches. The weight can be in kg, and if we click on this, then we will actually see the patient's BMI and the class. Cardiovascular system. Here the default is printed as no history of hypertension or ischemic heart disease or valvular disease. Patient denies any chest pain, shortness of breath on exertion, orthopnea, and other cardiac symptoms. There is another box which is not checked. It's for pediatric patient. So if you're inserting this for an adult patient, you don't have to insert anything. If you're inserting this for a pediatric patient, click on this, uncheck that, and it says pediatric patient, no congenital cardiac anomaly. Here in the systems which have particular systemic symptoms, the symptoms are registered here. If you click on symptoms again, then there is a whole bunch of symptoms that is present in the cardiovascular system, or you can add whatever you would like to add in this system. You can also put the classifications of New York Heart Association functional classification or Canadian Critical Society functional classification. Just choose what is the current status of the patient. If you have put them by mistake, please click on this cross button, which reduces all the data that was inserted to nothing, and it collapses again. But remember, if you have gone from default to other side and want to go back to default, please select accordingly. Once you move out of default, the default automatically is taken off. Here you can see the diseases that are mentioned, and all diseases have some kind of description. In the custom button, here you can add a new name if it is not in the system. So that way we make a foolproof data insertion system where you can insert any data which has been missed in the past. Same thing applies for respiratory system. The default, here the symptoms are there which you can select or add. In disease portion, there is a description which you can add. Asthma. As an anesthesiologist, we say whether the patient has an attack in recent year or not. Hospital admission, if you click on that, then we can have different subset of information which you can choose accordingly. So whether the patient had hospital admission, ICU admission, was there any non-invasive ventilation or ventilation, all this information can be added if anybody wants to. If you don't want to add any information, just click on asthma and it is recorded as it. The severity can be described as mild, moderate, severe, or other in your own expression, and whatever medication the patient has taken can be mentioned here as well. This is helpful when somebody is writing a consult. Hematological data, the default is the patient is not on any anticoagulant or blood thinning medication. Many patients who come for spinal anesthetic need this. That's why we have put this as a default. Or if they are on medication, you can click on the medication and see what kind of medications they are on. Now, if somebody is warfarin, we can do lots of information to be into this system. because those informations are necessary. On warfarin, you can write the date, which date you were stopped on if it is already stopped, or to stop on in future date, and you can increase the date here. So let's take 2016. This is August and this is the date, so you go up and you select the date accordingly. Now if we have added alternative medicine or bridging therapy, sorry, this is not required, then you select this. If it is required, we write down the name of the injection, we can write it here, the dose. If the patient needs to go to a doctor to get this, if a prescription was given to the patient, and if any other doctor were consulted, here there is a hint for the doctor, especially for those who will write down the bridgings. So warfarin says is to stop 5 days before OR and can be restarted 6 hours after catheter placement, removal, or manipulation. So this an anesthesiologist can check, but please uncheck so that it doesn't get printed. Same thing is for all the medications here. Steroid use, there is a list. So you can use the prednisone total dose per day, and as we know, to provide a stress dose of steroid, patient need to be on more than 5 milligram prednisone for more than 3 months. That's why it is put up here, so that you can write down whether the dose is more than 5 milligram or less, and is taking less than 3 months or more than 3 months or within 3 months. This allows you to enter any information from this patient which would be pertinent for future management of the patient. History of transfusion and reactions. So the default says no history of previous transfusion, people who haven't received any blood or blood product. In the list, there are a few other information that can be put in. There's a single history or multiple history of previous transfusion, or no reaction to previous transfusion. Reaction to previous transfusion, you can write down ABO incompatibilities, RH incompatibility, mismatch, or if there is a complication, we can put in the complications of massive transfusion if the patient has received massive transfusion, and then we can select any of them. There is also clerical error, and as usual, you can use any other information that is not in the system. All the systems are almost similar, and the most important thing and default is the nothing contributory. If you just click on endocrine, it says nothing contributory means no medical conditions affecting this system. GI system, here there are a few things that is detailed, and you can use any of them. In symptoms, we can put all these symptoms in the list. Here you can use anything. At fasting, you can use the number of fasting hours. Here it says whether it is hour or you want to add days. Custom, you can add it. You can, or here you can just add number of fasting hour, or here last meal, we can use it our time, so 13 hours 20 minutes, which means at 13:20 patient had the last meal. Or this can be used as last meal type. Was it a full meal, breakfast, lunch, dinner, and last drink type. Water, clear juice, unclear juice, black coffee, coffee with milk, milk, etc. These are the diseases that are mentioned here. In our next version, all these GI system diseases will be seen at the top. But right now, please visit into the list and write down these diseases. And here, once you select them, you can write down or select whatever treatment or current medications they are using. In terms of alcohol excess, you can input lots of information if you would like to. Daily consumption and the unit. Is there any hospital admission? History of esophageal varices, history of hematemesis. These are all symptoms of alcohol consumption and the information that are necessary to quantify the state of the patient. In neuro, again the same thing. There is a default, the symptoms are separated, and you can check other diseases where you can write down description of the diseases as you would like to add, and you can add many description of these diseases. There are many other systems in the body which has not been touched are included in here in the other system or diseases. This is according to an anesthetic division. So surgeons and an internist or general physician, intensivist, anybody can add system or diseases that is not involved in other areas into this area. Please get to the custom button and you can enter your disease and its description. Here is chronic pain, which can be used by the pain specialist or even a physician who wants to document about the patient's chronic pain. This can be given into different areas like location, and even if you click on the location, it gives you extra description which can be selected, like if it is in the back, and if it is lower back, click on lower. The onset, there are different choices: severity, nature and quality, radiation, aggravating factor, relieving factors, is there any functional limitation, emotional consequences to the pain, treatment received so far, the goal of the visit or treatment, is there presence of any red flags or presence of any yellow flag. If I want to just cancel this, as I have told you earlier, that we can easily click on this cross button and all the data entered will be wiped out, and I can collapse it as well. Here I want to show you something which is going to change in future. The boxes below the treatment options are actually a part of discussion with the patients. Here there are multiple boxes that can be selected according to the discussion with the patient, and this will go in future into discussion as a separate discussion for chronic pain. Please bear with us, which will be corrected very soon. Social history. There is a list and we can put as much as we want. Occupation, marital status, the number of children, smoking history if positive, so the number of cigarettes per day and number of years smoking. If there is any history of drug use, there's a multitudes of names there. Any recent history of foreign travel, which is important in terms of people going into infected areas where Ebola or dengue virus is prominent, can provide some clue to the clinician. Or history of exposure to environmental pathogen. We can, if we need this data, we leave it like that, otherwise we can collapse it anytime. Medication history, this contains name of all the generic medications and some brand names too. If you select a name, it also comes with some description. Right at this moment, this list gives you multitudes of doses, which is going to be sorted within our next available version, expected to be before next month. We can write down none, or we can go like cover seal, or we have generic name amoxicillin and we can pick it up. So all the generic names are there. You need to select the appropriate dosing. Sometimes there may be confusion between 250 and 500 milligram. So please select appropriately. This is all about history. I will come back with examination next. In the vital section, we can use systolic and diastolic either by writing 125, diastolic 75, or we can put the slider. Whatever you want to play with, you can play it easily. Heart rate per minute can be added here, or respiratory rate can be added here, whatever you want to put. Here we have temperature, and we can convert this temperature to Fahrenheit, the nearest one. This is important for any physician or physician assistant who would like to check the patient's vital and insert it here. Or if the reports are there, the surgeon, physician, anesthesiologist can enter it themselves. This examination includes airway examination for the anesthesiologist. The radio button, the pre-selected ones, are for your benefit, so that for Mallampati 1 you don't need to select it again. Mouth opening, 3 finger is first. Thyromental distance is more than 3 finger. Atlantoaxial joint extension, you can pick up the grade. Neck mobility, there are range of information which can be selected from. Teeth can be varied with these informations like own teeth, no loose teeth, no cap or crown. There is a loose top, loose bottom. Enormous description, and you can pick according to the ones you need. People who have dentures, they can be different selection of dentures, and that can be entered here. If the patient has any anatomical deformity, that can be entered here. Picnic, prominent incisor, or whatever the anatomical condition, that can be added. Cardiovascular system examinations is divided into palpation, auscultation, and inspection. Here we can select accordingly. In auscultation section, there are few pre-filled ones, and there will be another button to add if you need to add other things very soon. So you can select as required, or you can unselect them if you don't want. Inspection, JVP, you can select either elevated or not elevated. Similarly, respiratory examinations, general assessment and inspection shows this kind of information. You can have palpation and insert these data, or in auscultation, you can say select information that is already there, or here we can write down our intended description. Next is chronic pain and neurological examinations. Here the GCS is already selected at 15. If anybody changes this, so eye opening is 4, if they selected 3, that will change the GCS. So once you change it, the GCS here is expected to change. There may be a small bug during the recording of this video, but it will automatically calculate the GCS. This is the grading of World Federation Society of Neurologists, used by the neurosurgeon, neurologist, anesthesiologist for assessing or grading the patient with neurological issues. So you can select the appropriate grade. Many people use this mini mental scale evaluation, and that can be entered here. Then on the list is the actual examination and procedures that can be assessed on a neurological patient or patient with chronic pain. Alert oriented level of consciousness, pupillary exam, these are all self-explanatory, and there are informations in each of them which elaborates the topics. In motor system, we can use a muscle bulk, how is it, muscle tone, so we can select the name of the muscle. There are few muscles name that is given, or in the other tab the name of the muscle can be used. Once we select a muscle, then we can select the tone quality. So it gives you description or ability to insert data on each muscle individually. Muscle strength is the gradation. Same thing with the joint as in muscle. Name of the joint and response to movement. We can add if there is any tremor, any fasciculation. Check about sensation. If you go by dermatome, you can select the dermatome and write down what is the description in that dermatome. Or we can write down all as normal. Position sense, the patient can move the great toe up and down or lateral movement. It is understood by the patient or not. Vibration sense, whether it correlates. 2-point discrimination test, monofilament testing score. Others, the reflexes are elaborated as well. So we find the name of the reflex and the responses. We can grade it. So gait, Romberg testing, toe walking, hill walking, cranial nerve, all are there. In addition, there is a chronic pain examination which elaborates and finds the inspection and range of motion. So whether the patient is forward bending, how many degrees, we can write it. So forward bending is 70 degree, or we can say whether it's painful, it's limited, normal, or just select one. Surgical examination is not elaborated, but from this list all can be done, like for an hydrocele examination, getting above the swelling, or whatever is the surgical examination is can be entered here. There are few tests that is written up which gives mostly the chronic pain physician test, but in the other section all other tests can be added by any physician. After this examination, if there is a comment that the physician wants to write, this examination was satisfactory, and that can be added to the system. These videos, I do not want to make it long. In my next video, I will record about investigation, diagnosis, discussion, and others. Please keep watching, and please sign up at bdmr.com and sign in at ns1.com and play with it. Thank you for your support.